So when I started in wound care, we basically had nothing. We had gauze. And I remember lectures on whether you should use regular gauze or fine meshed gauze. And I think if you go down to the exhibit hall and you look at all the innovations and all the industry now involved in it, you can see that there's been, we've advanced light years. Still a long way to go. We still have a lot of more evidence to build, but for the most part, the increase in technology and advancements in the science have really been gigantic in a fairly short period of time. In our practice, we operate centers that go across the whole United States. We have a number of wound care centers, and all of them are interdisciplinary. They involve nurses, WOCN specialized nurses. Almost all of our centers will involve some physical therapy, and of course MD, DOs, and our podiatry colleagues as well. So my wound care mentor actually got me involved in research, and that was David Steed. And David was at the University of Pittsburgh at the time, and I went to my first wound care conference he was presenting at. And I got to know David fairly well. We used to run together. And one day he called me and said, "I've enrolled you as a site in a clinical trial." And that was 68 clinical trials ago. And so David got me started, and I owe him a debt of thanks for my wound care career. So, coming to meetings is very important, and obviously in a busy practice you may not have time to read all the journals or everything that comes out. So I learn a lot here. I learn a lot in the networking, out in the hallway, in the conference rooms, in the exhibit hall. This is really a week of concentrated learning. So, if you've got a new product and you want to, and you look at it and you say, well, this really has something that can help my patients, evidence-based, then there's different mechanisms based on the different hospitals. But we generally go to the hospital administration and say, this is something we want to get in the wound care center. We'll have to go through materials management. But if the physicians in the wound care center really want it, we'll find a way to get it. I said, go to SAWC, go to the meetings, listen to the speakers, and then talk to the folks in the hallway. I mean, you'll learn a ton. You'll meet people that you can call later on.